Hi again. So, what is mental health? Well, we've all got it. We all have our mental health as well as having our physical health. It just so happens that often we spend a lot more time thinking about and dealing with our physical health than our mental health. So, when we're talking about mental health, we're talking about emotions, we're talking about your emotional reaction to things. And often, actually, when you go into having a mental health problem, it can be a very normal reaction to what might be an unusual situation, which is why becoming a parent can really trigger mental health problems for a lot of people. So we know that about 1 in 5 or 1 in 4 women suffer from mental health problems during pregnancy and in the first year after having a baby. And we also know that fathers are affected too, or partners, because of their own mental health problems, but also as a reaction to partners' mental health problems. So it can become a bit of a vicious cycle. And what kind of mental health problems are we talking about? Well, nowadays a lot of us are quite familiar with the idea of postnatal depression. It's something that's talked about quite a lot. And also postnatal anxiety, which is talked about more and more. You might be interested to know that for most people, it's now known as perinatal depression and anxiety, because for most people, it actually starts during pregnancy rather than after the birth. It may just be that it hasn't been picked up on, those questions haven't been asked during your booking in appointments or appointments with your midwife. If you feel like that might be something that applies to you, then please do raise it with your midwife or your GP or any other healthcare professional that you come into contact with, because actually beginning to get support now during pregnancy can be really helpful in preventing things from feeling worse later on after the baby arrives. So, if you feel like you might have postnatal depression, that's often characterised by feelings of hopelessness, feeling really unmotivated, like all of a sudden you just can't be bothered to go and see your friends. You might also be surprised to learn that for a lot of parents in particular, it might be characterised by anger and irritability. So, that's the symptom that we don't talk about so much when it comes to depression. But actually, for a lot of parents, they find that becoming a parent can really bring out feelings of anger and even rage, which can be seen as part of postnatal depression too. For anxiety, you might notice that you just feel much more flustered than usual, you get nervous about things. Those would be very typical symptoms, but notice very physical reactions to things. So it may be that your heart rate is going, it may be that you feel very hot and sweaty or very flustered. All of those things are symptoms of anxiety. And we can view those things as kind of existing on a spectrum. So we all know what it feels like to be a bit nervous or worried about something. We also all know what it feels like to just be feeling a bit down in the dumps. But anxiety and depression are when those symptoms are feeling much worse than you would normally expect, and also they've gone on for a much longer period of time. So if you've been feeling like that for a number of weeks, then it's definitely worth going to speak to your GP or another healthcare professional about whether there might be some help available for you. There are also other mental health problems that often become more common during pregnancy and in the early weeks and months after birth. For example, all of the anxiety disorders, which are things like generalized anxiety disorder, that can be thought of as a kind of worry about worry, so worrying all the time about lots of different things. Also, obsessive compulsive disorder that you might have come across, feeling that you are very preoccupied, particularly with things like the health and safety of you and your children, and also having some sort of behaviours that help you alleviate that anxiety. Those two things go together. You might have a health anxiety, so that might be something that comes up for you. You might suddenly feel much more socially anxious. So all of these things come under the general kind of umbrella of anxiety disorders. So anxiety can manifest itself in lots of different ways, but in essence it all comes down to a similar root, and again always worth discussing that with somebody. There are also other less common mental health problems that can come up during this time. For example, bipolar disorder often relapses during pregnancy and after birth. Sometimes that's because of medication, but often that's also because your sleep is really affected and you've been through a lot of changes. It becomes very hard to look after yourself during pregnancy and in those early days. Also, again, less common but still around is postpartum psychosis, and that can happen sometimes in people who've never had any experience of psychosis or schizophrenia in the past, but it can also happen again as a relapse for people who might have had mental health problems before. So if you're aware that you might have a sensitivity to those things, then again, please do mention that to your midwife or your GP so that you can put a plan of action in place. If these are things that you've never heard of before and you don't feel like they're going to affect you, it is still always worth reading about them, knowing about them, speaking to your partner about them. Sometimes these things can come really out of the blue, particularly after birth, when you might have had a few days without sleep or without looking after yourself. You're thinking about a new baby and the last thing on your mind is yourself. So with all of these mental health problems or mental health difficulties, it's always worth getting somebody else to check in on you and make sure that you're feeling okay. Often after birth, the last thing that we're thinking about is ourselves, and that's when any underlying problems that we might have can really rear their heads without us necessarily noticing. I'm not saying that to frighten you, but just to be aware that actually this is a time when people generally feel a lot more vulnerable, and that that's actually quite a normal part of this process. So something that people don't know so much about, but actually we are learning a bit more about more recently, is post-traumatic stress disorder after birth. And that might be full-blown PTSD, where you have all the symptoms of post-traumatic stress disorder, or it may be that you also just have some traumatic symptoms. So they might be things like feeling very preoccupied by birth, wanting to talk about it all the time. It might also be actually that you avoid thinking about it or going anywhere near where you gave birth. So both of those things can be symptoms of feeling quite traumatised by birth. But also things like nightmares, feeling like you're suddenly back there. And often what's happened during that kind of birth or that kind of birth experience isn't necessarily that someone's had a particularly difficult birth, but that something's happened at some point during that birth where they felt quite unsafe. If you feel like that might have happened to you, then it's really worth thinking about having a birth reflections appointment where you can go over that experience with somebody. It's also worth knowing that actually PTSD after birth is often misdiagnosed as postnatal depression. So it might be that you're listening to this thinking, I think that something like that might have happened to me, and I've been taking antidepressants for a while and they don't really seem to be getting to the root of the problem. So that could be why, and it's something that people are having a growing understanding about, but is often still kind of a bit misunderstood. I did a campaign recently called the Make Birth Better campaign, and if you'd like to find out more about that, then please do go to www.makebirthbetter.org and you'll find lots of information on there. And do please let me know if you'd like to discuss any of that any further.